Burnout syndrome has an international prevalence, and its adverse effects affect health workers, although it also extends directly to patients, organizations and the health system in general. This syndrome is a condition associated with occupational stress, first described in 1974. It is characterized by the presence of increasing anger, frustration, paranoia regarding the influence of colleagues, excessive rigidity and inflexibility in practice, and the appearance of similar symptoms to depression. It is a chronic disease, which appears after a prolonged period of exposure to situations arising from their duties and the work environment. 3 different stages characterize this syndrome. Individuals initially feel apathetic and indifferent to the challenges of work, to the point where they do not want to get involved in any routine situations of their daily work. When the emotional fatigue becomes more intense, depersonalization and cynicism appear. The individual has a negative attitude, feeling isolated from his work. At a more advanced stage, the individual experiences a detriment in their productivity. Therefore, there is no recognition of the importance of their role and responsibilities, nor how their decisions can affect the lives of other people. Health sector employees may suffer from this syndrome because they are exposed to a profoundly changing complex context, characterized by numerous pressures on service providers, who may face constant challenges in clinical processes, subject to resource restrictions and sudden changes in the conditions of provision. The syndrome can be aggravated when they face leadership difficulties and ongoing conflicts in the performance of roles and interprofessional relationships. In this environment, the health professional experiences situations that require a high human and professional demand, which affect the degree of satisfaction of the healthcare teams, their perceptions of mental health and well-being, as well as their physical and cognitive health. Unfortunately, the effects of this syndrome not only involve the individual, but also it affects their relationships as an employee, the organizational climate, the patient safety and in general, the system as a whole. Recent studies show that the emotional effects of the health worker are related to a detriment in the quality of service delivery. The evidence indicates that a higher prevalence of emotional disturbance is associated with a more significant number of adverse events and errors in health services. The detriment in patient satisfaction is present, especially when it is the nursing team who suffers from this syndrome, which is reasonable if one considers that patients have a more frequent and close relationship with the nursing group than with doctors. Burnout syndrome interferes with the provision of health services, particularly in multidisciplinary or collaborative work groups. There is a detriment of patient outcomes as a result of emotional problems and the general disinterest of the health team. One of the most worrying aspects is the decrease in the sense of security of health professionals. That has an impact on the safety culture of the organization, exposing it to a higher risk of error and adverse events. I will not lie, the cause-effect relationship between this syndrome and the poor results in patient safety and medical errors is still questionable, but this is due to the design of empirical studies. More prospective studies are required, and I would like to find more research in primary care. But this is not a limitation to recommend to health organizations that they consider improving the mental health and well-being conditions of employees, to create a safer environment for the team and of course, for patients.